Care to chat? Hello and welcome to our podcast from the Northern Ireland Social Care Council. Social care and social work are such enormously important parts of life here. They really came to the fore during the pandemic. And now with the crisis in the health service, they're in the news again. So in these podcasts, we're going to find out about these jobs, about the people who work in them, the routes into social care and social work, how staff can progress and develop their careers, about the reforms taking place, and very importantly, how people in these fields take care of themselves as well as their clients. Of course, leadership is crucial in any organisation, and perhaps even more so in an area as diverse as social work. So what does it mean for those involved in the whole field? Well, let's talk to Maura Dargan, Executive Director of Social Work and Divisional Director of the Children's and Young People's Division of the Northern Health and Social Care Trust. Michelle Janes is Director of Barnardos NI, and Vivian McConvey is CEO of the Patient and Client Council. Great to have you all here. Thanks very much for your time today. Might not be a bad idea to start by just finding out a little bit about what each of you does or about your organisation. If I could, maybe you'd like to start there, Michelle.
Yeah, hi Wendy. So I lead the largest children's charity here in Northern Ireland. We're a charity that delivers services right across Northern Ireland. We have about 45 services. We deliver to around 18,000 children and young people and their families. And we work with children and young people right through from that, I suppose, very early baby stage, in our infant mental health services, right through early intervention, family support, our looked after children who live with us in our children's house or in our leaving and aftercare services, provide fostering, and recently we became an adoption agency here as well in Northern Ireland.
So it's a really wide remit, actually, isn't it?
It's a big remit, and we deliver services on behalf not only of the Health and Social Care Trusts or the Department of Health, but communities and the Department of Education as well.
Okay, so the nightmare that is cross-departmental working, but you seem to be managing it well at the moment. Vivian, what about the Patient and Client Council? I mean, it sounds a bit obvious what you do, but sometimes that's not always the case.
No, Wendy, it's not. And I suppose where we fit into everything is that if you think about health and social care, it's immensely complex, it's immensely big, and really for a lot of people navigating that is a real problem. So we come in at the Patient and Client Council is to help people navigate health and social care. So we would offer both advocacy and engagement and involvement. So our job is about working from the individual bit in which people have an issue or a problem around their health and social care or don't know where to go. Stand beside them, walk them through it, try to make sense. Like today you're going to talk about social work across a wide range of services. Think of the Patient Client Council as all of the services that are available in health and social care. The other part of it as well is we all own health and social care. So therefore we should own the decisions made about health and social care. So our job as well, apart from being advocates, is also to find a way that where decisions are being made about health and social care, the Patient Client Council assists the public to get to the right table, to have the right conversation and to get involved. So part of our job as well is to pull back a chair at a table, find that decision-making role and allow people to become part of that conversation.
Good. Well, that's a really nice, clear explanation. And Maura, you have an interesting job, haven't you? You know, both across being Executive Director of Social Work, Divisional Director of Children and Young People's Division. That's a lot, isn't it?
It feels that way, okay, Wendy. So, yeah, there's across each of the 5 trusts, there's a Director of Children's Services and then this Executive Director of Social Work title. And that really came about because of the statutory functions that sit in children's services and the need to have an executive senior within each organisation to make sure that the needs and rights of children were being upheld. So yes, it's 2 jobs rolled into one. So operationally I'm responsible for a wide range of services, mostly social work, so from early intervention all the way up to children subject to child protection plans, and then our looked after children who are living with family, with foster carers and our children's homes as well. I'm also responsible for services like children's mental health, autism services, our allied health professionals. So there's quite a multidisciplinary brief for me as well, which is great because all of those connections for children are needed all the way across. The Executive Director of Social Work function for the organisation is about having leadership for social work across the entire organisation. So for all social workers, wherever they are based, it may be in older people's services, maybe in hospital social work, that they are supported and have access to training and are registered and have good leadership and good forums and good connection to the profession. So I am an accountable officer for that at Trust Board table. So it's quite a big brief.
So that leadership aspect, I mean, how would you describe the way that you work perhaps in that area of leadership, which you've just said is an enormously important one?
I suppose I recognise that I don't know all of the answers, and there are people around me who do, and there are people with knowledge and skills that far outweigh mine within different contexts. And I suppose as a good leader, it's my job to find those people and to see where it is that they're working and what value they can add. My experience actually of leadership in a very collaborative way was probably through the management of the CAM service, because it was multidisciplinary. There were different clinical people in different roles, and they weren't always in senior positions, but their expertise was essential for our decision making around how the service would be delivered. So we couldn't have done it without a number of clinical people and a lot of professionals and a lot of senior managers in the room making collective decisions. So I think for me it's really important for all staff at all levels to identify who their natural leaders are and really develop them and build them as much as possible and provide the right table and the right seats so that they can have their voices well heard and that they are I suppose, influence and decision making at higher levels than their position kind of allows them normally.
How important is that in your field, Michelle, that people at different levels feel their own leadership, if I could put it like that?
I think it's really important. Maura makes an excellent point, because leadership isn't just something that comes with a title. It's something that's essential at all levels throughout the organisation, no matter where anybody's working, given that you're working on a day-to-day basis in lots of different situations. So it's really important that we're able to identify where that leadership is, as Maura was saying, but sometimes those solutions to some of the challenges that our families and are facing out in the ground are solvable by those who are right alongside them, who are there at that time in the right place, right time, providing the right sort of intervention, and getting that, being able to tap into that where families are at is really, really important. So it's really important for us at Barnardos. We've I suppose, a number of different levels of leadership programmes. So it's identifying it at the earliest opportunity, but also, I suppose, just to acknowledge that sometimes people need to use those leadership skills where they are. It doesn't necessarily mean it's for climbing the ladder or for coming into more senior positions. It's about using them to benefit people where they're at, to help them make the right decision, and then if they need the support from the wider organisation, then that it's there. But it's so essential to be identifying those leadership skills and talents and areas at the earliest opportunity, so that you can grow your workforce, because we all know we have loads and loads of challenges in our workforce, but to grow them and offer them opportunities if that's what they want, but also to help them use those skills to add value really to what they're doing on the ground.
And I suppose that whole thing, Vivian, with social work and with looking right across the health and social care picture, as you said, the PCC does, you have, maybe sometimes you have to be the leader of the person with whom you're dealing, or maybe not always the leader, but sometimes a kind of facilitator or enabler or empowerer or whatever.
Yeah, well, I think when you think about leadership, if we think about I'll talk about it in two levels. One is with staff, and then the other is with the people that we work with, and getting people to get to a table and be involved and engaged in leading out in their own life. It's the same thing. I think there's a 50-50 rule. And the 50-50 rule is that 50% of it comes from the person who's motivated, and 50% comes from the organisation and whether the organisation is ready and actually invested in and supporting people to develop their leadership. Because the first thing they'll do is they'll look around, and if you want to learn something, you get alongside someone else who's doing it really well. And for organisations and for us as managers, or any manager, you need to make the environment right. Assisting people to look after themselves, having the right circumstances in which you support them, giving them opportunities, not having a control and command, working with flexibility, working in the grey. I mean, good leadership is always working in ambiguity. Now, the same goes for when you're dealing with people, or a lot of my work. All of my work is different. My work would be very different from Maura's. And if I look back in our careers, mine's come from an angle of social action. And where I was involved in that was very much about how do you help and facilitate people in relation to their own destiny, find their voice and work in a group to make that social change end of it. And you're always looking for leaders in that. But what is that about? Again, it's like a 50-50, but sometimes with people who've never had the experience of or been lucky enough to be engaged and involved in things, you're starting at a low percentage where you're building their self-esteem, building self-confidence. It's the same for workers. You're finding the space and then how you work with them. Because where you want to get to the end, either with staff or with people sitting at a table, is that they say, we did it, not I. And actually, you're standing behind them. And what you've been doing is you've been there to facilitate a growth and development programme for them. And your job, mostly in most things, is about motivation. Now, the best people to do that are social workers, because what are we really good at? We're really good at listening. We're really good at creative thinking. We're really good at critical thinking. We're good at action planning and holding the focus. And those type of skills that you have in social work really well in relation to finding, should that be a staff member or a member of the public or anyone, to find themselves, because usually the solutions to big problems come from people themselves or from groups of people. And that's what I've seen throughout my career in leadership, and that's the bit that I've tried to promote in relation to what I would see as my leadership. One is motivating others and taking responsibility for the environment to make that happen.
Yeah, I think that's really helpful to hear that. I suppose I just wanted to comment that whenever it's a rare social worker that isn't a natural leader, in my view. Mm-hmm. I think natural leaders tend to choose social work as a career. I think that we have all experienced families and scenarios that have been challenging or difficult where other professionals have been involved, either unidisciplinary or as a group. But actually what has fundamentally made a difference for that child or adult or family has been the intervention of social work. And that's because of the leadership role of bringing the professional group around the table to collectively work out and listen to what is happening to the family and how to respond. And we hear that all of the time, how the intervention of social work actually makes that difference. But that is we call it coordinating. We call it it's a coordinating role, but it actually fundamentally is a leadership role. And I think it's been disingenuous actually to call it coordinating when it is actually so powerful.
It's about the how, Maura.
Yeah.
I mean, our work very much is sometimes not about what we do, because you could break it down into a set of skills or a set of activities or actions, but it's actually how you do that and how you do that in a facilitative role, because at our value base, at the centre of that, what we have is self-determination for people. We have a belief that people can and will find a way and actually know more about it than we do. Because the day and hour that a social worker walks into someone's life, the clock is ticking. You're not there for a lifetime. So the point about it is, how do you make best use of that time so that the day that you're not standing in somebody's life. So in my early days of social work, and when I was working with children and young people in my previous life and now, and I even say it to families now when I'm working alongside them as an advocate, we have to think about 5 years from now, when I'm not in your life and there's a huge trauma, because social work, we come into people's lives when there's crisis, there's challenge or there's change, and we need to be thinking how that person will be well after we leave them. And that's about how they master their own destiny, how we support and how we do our job, how we ask the questions and facilitate that. And so that's where what you're saying there about social work and leadership, it is there, because what we're trying to do in that is you're leading the conversation, you're leading an intervention with someone, but the end of it is that someone else determines their own destiny well after we're out of their life, if that makes sense.
It does, and it's interesting, just I've written a few words down here from what you've all been saying. I mean, it's interesting that coordinating, I suppose, when we think about it, is leading, really, isn't it? And all of this conversation now about leadership and how it is coordination and how it's collaborational and so on. I mean, that's only going to work if the person who's doing the coordinating is prepared to listen, which is the other thing that I've written down here, which seems to be one of the most important things, Michelle, that leaders in this field can actually do.
I think it is. I think also the bit is about pulling it all together. We're not very good as a social work profession about being as articulate as we could be about what we're really good at. And the point about leading is really, really well made. But that bit about being able to really listen to children, young people and families, for me, in the world that I have always worked in. And as I've taking on new leadership roles, ensuring that I'm still hearing what they're actually telling us, because we could be moving in a way that actually doesn't reflect them. And for me, it's really important as a leader that I still keep my finger on the pulse. I like to taste, smell and touch it, if you like, because as you move into different roles, sometimes you can become more removed for that. And for me, what's been really important is to ensure that I continue to listen to our children, our young people and our families, and I continue to listen to my colleagues, no matter what job they're doing or what sector that they're in, to ensure that how I lead and how I support my team or how my team delivers then services is informed through a really active listening of what's really going on the ground, not what I might think or what Maura might think or what Vivian might think, but that's really, really that we're still in touch with that. And that's been even more important, I think, as we've come through COVID, which was I suppose a leadership challenge I don't think that any of us will ever have how could we ever imagine? But at that time, it was really even more important to hear about what was happening, the impact that was having on people, and how we could then, as organisations, respond. But to do that, there was responses being developed. But were we really hearing at that time what was really, really needed at the ground? And for me, that was a time when I was learning an awful lot more about different ways of listening, especially to our children and young people, because they were telling us in very different ways than they would on a usual, a non-pandemic day, if you like.
Yeah, yes. Who would
because I'm not even going to use that other word.
Indeed. That whole business, Maura, with you saying, that social workers are natural leaders, are they then, when they get to the kind of level that the three of you are at, are they still good at encouraging others in the social work profession to take up actual leadership roles as opposed to maybe the kind of not being the natural leaders that you think they are? Sometimes you have terrific leaders, but they're not necessarily very good at encouraging those who are following along behind them.
I think as a profession we're actually quite good at that. I think we listen well, we observe well, we assess well, and I think by and large we are good at communicating the good, the bad and the ugly. And the good is, people are doing very well. We reinforce messages when progress has been made, when people are doing well at their job, and how it is they're presenting with families at all different levels. Could we be doing it better? Absolutely. I think within all of our organisation, within the trusts and stuff, as you've outlined, there are formal programmes and training that people can avail of and develop through. But mostly people learn through modelling and being exposed to and being round tables that are at senior levels that they wouldn't ordinarily have access to, but being encouraged to present at those, being encouraged to attend those, being encouraged to participate in those is a way of developing people in real time. So I think we are as good as, probably better than most professionals in recognising and developing our talent. Is there room for improvement? Always.
But can I come in on that? Because I'd like to add to that. And I suppose where I'd like to add more is I think we're missing a trick. And where I'm coming from as being a social worker outside of the mainstream social work, one of the things when I look at what social work brings to the table and the skills that we have, I think sometimes we're not pushing our social workers to actually spread out into different fields. I think we stay in a very social work world, whereas I actually believe coming into the job that I'm in now and did before, I believe that there's a much more breadth of leadership roles out there. We should be encouraging our social workers to aspire to go into and not just stay within the house of what seemed to be like the social work profession.
That's hard to do though, isn't it, when you're keen to hang on to your really good people?
It is, but it needs to be done, because the other thing about it is that if you look going forward what we need in health and social services, if you look how Maura described everything earlier about multidisciplinary practice and how we're working, that is different. So for me, looking right across the health field, and I've only come in, I've been in the voluntary sector, started in the statutory sector and justice in the voluntary sector and come through now into a very wide breadth. I can see very senior roles that will be leading health and social services in the future, and I do believe there are places there for our social workers to stretch out and to go for those roles.
Maura?
I would completely agree with that. I think it's incumbent upon social work actually to be in those spaces. I just wanted to reflect my position at Trust Board within the organisation as the only social worker in that space. That it's mainly an acute agenda, as we would all appreciate and understand, for the health and social care trusts. So as a social worker around that table, it's a lonely voice at times. But I am struck by, in the last number of years, having had the privilege of this job, about the impact and influence that I can have round that table for non-social work, what viewed to be non-social work agenda items, things around hospitals, staffing, the organisation of things, that I come at it from a perspective that adds value, and that only comes with the profession of social work. So I think trust boards benefit from social work being around the table. So it was a very wise person who decided that social work needed to be there as an executive director.
Yeah. And I suppose it also underlines the fact that it's maybe time to, as Vivian says, look at the leadership from a different perspective, and not that traditional systems outlook. Because the last 3.5 years, everything's gone out the window anyway. So it's maybe time for a reset, a more holistic, rounded attitude to leadership. We've been talking in another of these podcasts about compassionate leadership, and not a word that I think I ever heard from anyone who was my boss. And is it time for social work leadership to stand up then, Michelle, within that kind of integrated system?
I think that I'm actually, your point was just so good, because I think that there have been opportunities that social workers haven't taken, because we have really stuck to our own fields, and I have seen things recently where I've thought, why are we not there? Why are we not being heard? We could offer something really creative, something really solution focused. We could, we've managed crisis. We're involved in situations when things are really, really edgy. We have those good negotiation skills. We negotiate in very different environments, whether that's in courts and education and the client council within trusts, right across loads of different environments. And when in lots of the multidisciplinary teams that have been developed, they've been led by clinicians more than social work, and I've often wondered about that. I do think that as things change over the next couple of years, because we are in a very different work environment, political environment, health environment, I think we have to look at what role social work has in that. We also have to allow our social work leaders to be able, I suppose there's two bits. There's the bits about, yes, we need to spread our wings, but there's also a bit about allowing our social work leaders to do the social work job and to be allowed to focus on that, because there's many people are carrying out multiple roles, and that then can shift the focus from where it needs to be. So yes, spreading our wings, because I do think we've got an awful lot to offer and an awful lot of different ways of looking at things. But I also do think that there's a role in terms of our own profession about how we lead with a stronger voice and focus on the work that we need to do.
Maura?
Can I just pick up a point just about why it is that social work needs to be at all of those top tables and top jobs? It's because of our systemic training and our understanding of systems and how children and families and adults, how they operate within a system, and then how the system operates around them and the networks that sit around them. That's how we think. That's how we plan. It's how we assess. It's how we understand it. And whenever you're working in unidisciplinary social work, you assume that everybody thinks that way and understands that and make decisions based on that. But actually, when you're exposed to multidisciplinary colleagues, that's less obvious. So I do think the future for health and social care in the widest sense, in the widest family, requires systemic thinkers at the top tables to be able to deliver what it is that we need to do in the next number of years.
Serious agreement round the table with
yeah,
that,
but I mean, one of the bits that I want to come in, when I'm talking about social workers in leadership roles, I'm saying don't be thinking of just going for a leadership post. Here's what I'm talking about. Look right across health and social services. Look right across the voluntary community sector and different things. I really think that the skills that there are there in social work need to be at those tables that you're talking about. Systemic approaches, critical thinking, focused thinking, action planning, all of that stuff. So what tends to happen is I don't think at this point that a lot of us are seeing ourselves in very different jobs. So when we come into social work, we feel like we have to stay in that. I'm saying we've got so many tools in the kit and the toolbox is full, and actually what you've got in that could be seen in this job that you do not necessarily see where other professions do. But also, I think we have to change from the bottom as well. We have a fantastic post-qualifying framework, but a lot of our stuff is done in post-qualifying framework and training. We actually need to bring in a different way in which we have to give our social workers different experiences in different areas. And so there's a little bit where I think we need to get back and do, like R&R, rest and recreation. Our social workers work really, really hard, but we're not spending enough time where we're giving them the opportunities of something that's completely left field. Something that's out there and something that's very different, where they get time to review and reflect. We do it through training, but unlike other professions, we haven't got that built in, where we're allowing people to sort of begin and develop that. You'd like to see people where you need a little bit, where they need something that's really interesting in their own project, or to find that and to work in partnerships. And that's where both of us come from, the voluntary sector. But we don't get enough of where you would want some of the workers, of our workers, going in and working in there with projects, and some of the workers who are in statutory getting space and time within their working week to come out and do joint partnership projects, which is working together in a different way and owning something. So from that very beginning. And that's why I think we get so stuck in just doing our social work type stuff, where I think we need to give time for more review, reflection, and do some little bits different and time out.
I mean, you all have enormously time-consuming jobs and all-consuming jobs, and I would have thought in some circumstances. I mean, in my introduction to this, I was talking about the fact that one of the things we've been looking at has been how people in the fields of social care and social work take care of themselves and their own well-being, as well as looking after their clients. I mean, Michelle, if I could maybe put this to you, you're dealing with the incredibly challenging funding area at the moment. There's hardly one of these podcasts that we've done which hasn't referred to the fact that there aren't any politicians currently. And, maybe by the time someone's listening to this, they might be back, but equally they might not. So how do you then use your leadership skills to work through all of that to make sure that the things that really matter are still happening, and that you're looking after your staff and you're looking after yourself and you're looking after your clients? It's a massive job.
It is. Where do you start? I think, my bit is I'm very vocal about within our teams. We do a really good job. We do our best, but to do our best, we've got to be at our best. So we have a range of different initiatives and supports and things that staff can access, whether that's for somebody additional to talk to, clinical supervision, or whatever regular supervision, but also that bit about being able to access support where they're at. So if somebody needs a float, if somebody wants to do something really, really different that's going to help them to be able to manage work better, then we will always look to accommodate that. We've become more creative about some of the options that are available, because not everybody can do it through having a conversation. Some people can become very stuck. Regular breaks are really, really important. My bit is about I am quite close to my staff, as well as, and I don't mean that in terms of I'm always sitting beside them. It's about being in touch with them. So, popping into different meetings, taking feedback from staff, hearing what's really going on and what's really impacting. I'm trying to build something in to support them. In terms of my own bit, I'm a mummy. I have a big family, and I have a lot of space. I'm married to somebody who's always worked in the voluntary sector, who loves the environment. So there's lots of animals and land and things that are growing, and that's where I suppose rest my head in terms of getting a bit of space and time to think or to reflect. But I also get a lot of support. I have wonderful people alongside me, really wonderful people. And I don't just mean within my own organisation. I think over the last few years there's been, we're not there yet, but there's better working together. There's people hearing you and people getting alongside you saying, let's look at doing things a bit more differently. Let's talk about, or I noticed, can we do things together? And I think that really helps. The social work family in Northern Ireland is a huge one, and there's huge potential for us to do things better and more together. And I think that will make things a bit easier for all of us. We're not at the right bit yet, but I think as a profession we always know there's always going to be change and challenge, and there's always going to be growth, and there's always going to be new. And as we move and do that together, that really helps.
And Maura, that's an interesting example, I suppose, there that Michelle gave you about the social work family. Are you optimistic about how maybe the natural leadership ability of social workers and the actual leadership in social work can have the kind of effect that you think is necessary at those boardroom tables, and to stand up within that integrated system?
I absolutely do. I think there are people within the existing system. I could name quite a number who are fit to move into any one of our jobs and probably do it better. Quite a number of them. So no, I have every confidence about that. I suppose the thing that I am anxious about for the future of social work is the attraction into the profession in the first place. There is something fundamentally happening for social work amongst school leavers who aren't really seeing social work as a career option for them. And so we're not getting the numbers that are interested. We don't have enough student placements for social work, so we are not having the supply year on year for the very many growing, developing number of social work jobs that there are. So we have a fundamental problem, I think, at the very beginning to get into social work. But I think once social workers are in there, and people talk about it. Social workers talk about social work getting in under their skin. Whatever job they're in, they just live, breathe, work it, and they will stay, and they will get good opportunities, and they take good opportunities, and they work hard for them, and they're ripe for the picking. Quite a number of them. I'm very confident about that. I think social workers learn very early in their career that it's a challenging and difficult and sometimes distressing job, and that we rely very heavily on each other. And you will find in any social work team that there are relationships that have developed beyond the team that they work in, and lifelong friends. I know for myself, I have lifelong friends that I started my career with, that in the middle of my career and towards the end of my career, that have supported and energised and held me up at times, and I hope I've done that for others too. But we do that very well as social workers. We check out on each other and we look after each other and mind ourselves and each other, I think, very well. So I think it is a supportive environment, but I do feel for our frontline teams, for our social workers and our frontline team leaders that are trying to manage the number of vacancies that they have, the number of families who require a service, and to contain themselves and to contain the team that they work with is extremely challenging just at the moment.
Vivian, you're about to step down from the PCC just in the next few weeks. Just briefly, you any sense of optimism for what comes next for the social work environment?
Oh, absolutely. I mean, social work is optimistic. Social work is about opportunity. The personality that comes into it has a belief about change and has a determination around that, and actually a discipline about trying to find that. I think one of the things for us is that people sometimes misunderstand social work. Because if you look at the breadth of social work and you were to sit down, take a longer discussion with us around talking through Michelle, Maura and my career, you couldn't describe probably 3 more different careers. And social work has been good to us. We've worked hard, but it has really gifted us with, like Maura said, friends. Yes, you have challenges. Yes, you have all of that. But for us, I think I'm really optimistic if we can get the message out there that to offer yourself into this, if you have the personality, the attitude and the aptitude, this is a really, really good career. It's a career that'll take you around the world. It's one of those careers wherever you go, you will get a job and you will connect in with somebody. And what we need to do here is to demonstrate and to show that and to bring people into this career. I am really optimistic about it. I'm also really optimistic that we're having these conversations now, because I can see some of what we've been talking about here today is very much about saying, we have very skilled practitioners who could see themselves anywhere in health and social care and have a lot to offer, because we have some very wicked, sticky problems to sort out in the future, and it takes a certain type of critical thinking to be sitting at that table and ensure that we're thinking it inside out to get the solutions. And you have no better place than the thinking that we've all been trained in to be sitting at that table.
Well, that's good to know from where I'm sitting. Thank you all very much indeed for joining me for this podcast today. Thanks to Maura Dargan, to Michelle Janes and to Vivian McConvey. Good luck with the rest of what you're going to be doing, Vivian. And thanks for joining us today.
Thank you.
Thank you.
This has been Care to Chat, a podcast from the Northern Ireland Social Care Council. Thank you so much for listening. And if you'd like to learn more about careers in social care and social work, visit niscc.info, where you can find inspirational stories, great learning resources, podcasts, and much more.